Hi, it's me again, and this is my number 2 YouTube video. And right now, I'm in a specialist office about hidradenitis suppurativa, and they're just going to say a little bit about the do's and don'ts and what might help for ones who might be scared to go to the doctor. And here they are.
Hi, how are you doing? Yes, hidradenitis suppurativa is a condition that can be very debilitating, and you know, it requires a lot of effort to take care of. It's not you know the patient's fault. It sometimes runs in a family. There's some factors that do make it worse, such as smoking. I think trying to control the weight is always helpful because that flares. I mean, we generally see it in patients who are heavier. Although we do have occasionally some patients who are not overweight. Other ways to control it is to keep the areas clean with bacteria soap to prevent overgrowth of bacteria. On its own, hidradenitis is not a disease where your skin is, you know, infected per se, but it's just overgrowth because it's the glands, the skin structures where the pores are blocked, and then the immune response to the bacteria that overgrows is abnormal. So that's really the crux of the problem. We use antibiotics to control the inflammation, not to really kill the bacteria. The antibiotics that we use generally have anti-inflammatory properties. Knowing that, we actually have developed new treatments, immunosuppressants that have been developed that are very helpful for patients in the early stages of the disease. In advanced stages, I think with severe scarring, surgery is one of the treatments. But there are treatments to, at this point, prevent it from getting very severe, or at least helping patients so that it's not so severe. It doesn't get to be severely scarred, so I think it's worthwhile to see physicians and experts who are familiar with this disease.
Thank you. Do you have anything to add, or?
Other than, yeah, I think it's good to also look and make sure that, see if there's any kind of research programs going on around wherever you may live, and there's some new medications on the horizons that is very effective for that, and a lot of times with the research you can get those medications for free. So that's something you can go to different, just Google, research in your area for that. And diet is important as well. So I think it's really important to avoid inflammatory foods, sugar, gluten. There's several of them out there that you could also Google and see what they are, and see if that works for you as well.
All right, thank you guys, and don't forget to like and subscribe.